I'm Celestin Akulo. I'm the nutrition coordinator for FHI 360 Ukraine. Today, I'm presenting on AI-powered solution to transform IYCF support, the Ukrainian experience. What are the problems and opportunities? The key IYCF challenge that we've observed during the conflict here in Ukraine include low exclusive breastfeeding rates, limited lactation support in health facilities and communities, exposure to aggressive marketing of breast milk substitutes. During one of our field visits, a mother shared her frustration after being urged to switch to formula by hospital staff, despite her strong desire to breastfeed. What was the result? The woman felt unsupported, she was confused, and this highlighted the critical need for trusted and consistent guidance. What is the key question? How can we scale support during emergency to ensure mothers get real-time guidance and resources that they need to breastfeed successfully? Because of what we experienced in the past during our nutrition program already happening in Ukraine, we have to brainstorm and think outside the box. This resulted in us coming up with the digital solution to support women and their children. What are the objectives? The objectives include to empower women and caregivers with reliable health and nutrition information in real time, to support early childhood development and maternal well-being, to signpost and connect users to lactation counselors and health workers in their catchment area for individual counseling, and to link users to virtual Telegram support group, which is already existing. Solutions. The solution we did was to bring key tools together, and this include the ChatGPT, the OpenAI platform, the Canva, the Sempos, and the Telegram support and the Telegram app. Why did we use the Telegram app? The Telegram app is the most popular messaging app in Ukraine. Hence, we brought all this together, the ChatGPT serving as our back end, the Sempos being the automation mechanism between the ChatGPT and the Telegram app. While the Telegram app is serving as our front end or the user interface, where the user, in this case, our beneficiary, used to access information that they need. Who do we support? We support pregnant women and lactating mothers seeking prenatal and postpartum information. We also support new mothers navigating infant care and nutrition. We support caregivers and fathers of children under 2 years. We also support healthcare providers seeking education and referral tools. Obviously, we support community members promoting best practices in infant and child care. What are the key features of this digital tool? The key features include real-time questions and answers, which means the beneficiaries can use them to ask questions and also get immediate answer. There are also referral links, either to the health facility, to our support group, or to a skilled IYCF support. Educational videos can also be gotten from the platform. The beneficiary can also schedule an appointment, have access to offline resources. There are linkages to support group, and also we've been able to integrate other sectors in this digital tool for a robust and comprehensive programming. The quality and trust. We ensure that our back end only contains resources from WHO and UNICEF. In fact, we make sure that any resource going to our back end is vetted, which means that the platform can only transmit or display information within from a restricted source, in this case, a UNICEF or WHO provided resource. And the automation between the ChatGPT through Sempos up to our delivery platform, which is the Telegram group, the Telegram app, has been wonderful. The user feedback also helps us for updates, critical updates, where we feel, okay, based on this feedback, XYZ update should be provided. And the referral system, which means in this case, where the user needs a tailor-made support, we can the digital tool will signpost the user to either be referred to the health facility or a master lactation counselor. What has been the performance so far? We developed some monitoring methods to check our metrics and monitor and know when we are doing well or when we are not doing well. They include number of active beneficiaries, number of users that are accessing links to individual counseling, number of those exploring topics on nutrition, those engaging with topics and questions on early childhood development. And we also have a way of monitoring beneficiaries, assessing our IYCF support groups through the digital platform. We also monitor the number of beneficiaries that are referred from the digital platform to the IYCF support group, and we track this through Kobo. What are our privacy commitments? Obviously, there are commitments in our parts, and they include ensuring that our data is anonymous. We also ask for consent, from the beneficiaries before they will start using these digital tools. Also, we comply to the General Data Privacy Policy, which also FHI has. What are the early impacts? I want to say that between October 2024, when we started this, and now we have more than 2,600 unique users. 13 master lactation counselors are currently providing individualized support for those for people that requested for it. There has been common questions that we've noticed and common topics that are being viewed. They include topics on lactation myths and facts, breastfeeding tips and techniques, and consultations with a specialized counselor. In this case, about 40% viewed topics or contents on lactation myths and facts. 50 explored those on breastfeeding tips and techniques. What are the next steps? The next steps include expanding the content. We will need to expand the content, include so many other materials from WHO, from UNICEF, ECD components, also expand some other key aspects such as the MHPSS and the GBV aspect. We also need to link all our focal points at the health facility. So far, we've not been able to link all focal points in the health facility, about 139 of them. We have not linked them to this digital platform, but we hope to do this in the next phase. We also we've been advocating for the adoption of this digital platform by the health administration. Obviously, this will lead to amplifying the impact, the positive impact that this platform is having. Again, what we envisage that will happen at last is to scale this intervention to other oblasts in Ukraine. Thank you so far, and I believe that together we can transform IYCF support, one IYCF counseling at a time. Thank you.